Hi everyone, this is Dr. Naina. Welcome to my show, NainaMD Fusion of Science and Beauty. And today I have a very exciting guest, Dr. Steven Ross. He's the founder of the Advanced Medical Academy. It's a teaching institution. He also practices functional medicine. And I'd like to welcome you today.
Thank you.
How are you?
Wonderful, thank you. Thanks
you
for
have a
having
drive
me.
from San Diego?
A little bit,
Yeah.
but it was nice and smooth.
Did you
no
leave
traffic.
in the morning? No traffic. That's
No
unusual.
traffic. Yeah, I was flying low.
So you were flying low. Most of the time there's so much traffic.
Time.
Yeah. So tell me a little bit about, I know you're practicing functional medicine in San Diego.
Yes.
As you know, I practice functional medicine as well. I want you to tell the audience what is the most common things that you see, and what is the most common intervention you do as a functional medicine doctor? Well, and before even that, just explain a little bit about what functional medicine is.
Sure.
Yeah.
Well, functional medicine, as you know, is medicine that looks at the root cause of health challenges as opposed to the end result, the disease. Right. Whereas traditional medicine is great in acute care, but ultimately they're looking for the end result. What is the diagnosis, and what medication can I use to suppress the symptoms? So in functional medicine, it's all about finding the root cause. So in answer to your question, there's a whole variety of patients that I see. But you know, I think we could really put it into just three categories. One is the gut, one is the mind or cognitive, and the other is hormonal. And
I think with the hormonal, the most common is adrenal fatigue.
Absolutely.
And I want to really focus the show today on adrenal fatigue, because everybody, 90% of my patients come in and say, Dr. Naina, where do you get your energy from?
Right.
Okay.
Right.
And I'm telling the audience today, you know, I really walk the talk, because I don't do drugs, I don't have any medicines that I'm on, and I am able to sustain a high energy level because I really practice what I preach. It's functional medicine. It's all about lifestyle. It's all about management. I'm not saying I'm perfect 100% of the time as far as my diet goes, but I come close to it. And so having said that, I myself, I remember before I even went into functional medicine, and I remember when I was when I was going to medical school and when I was in my 20s, I feel better now than I was in my 20s, okay? I have more energy now than I was in my 20s. And I was always tired. It was so hard for me to get up in the morning, I got going, and it was just like I just felt always just tired. Or there was sometimes the afternoon. If I did get going in the morning, then it was the afternoon was horrible. I couldn't keep my eyes open.
Right, that afternoon crash.
I don't take coffee, so I'm not a person who drinks coffee. So I had to like really literally fight the fatigue. And after I started practicing functional medicine and all of this, what I do, like I said, the energy levels are amazing. Right. But I recognized that I was suffering from adrenal fatigue. And I think everybody in this Western society and globally now that has to deal with the tech age, so to speak, is going to be adrenal fatigue. So if you could define a little bit about what adrenal fatigue is, and then why, maybe I'll get into why conventional medicine doesn't even recognize it as being an entity. They just think it's like a garbage term. Right. But 90% of the people come to see me is because of fatigue. I'm sure they do the same thing.
Right. I think there's a very high number of people that come to me, and it doesn't have to be an older age.
No.
I mean, we're seeing kids in their 20s.
15 years old,
that are
20-year-olds, right?
They can't get up in the morning. Yeah. And once they get up, they can't stay awake. Or after lunch, they're feeling fatigued or whatever it might be. So there's really 3, maybe even 4 stages of what we call adrenal fatigue. The first phase is the individual that gets up in the morning, they're a little tired, but they kind of make it through the day, but they're feeling this little, wax and wane of feeling good and feeling exhausted. That's phase 1. And phase 2 is probably the majority of the patients that we see. They get up in the morning, a little difficult to get up in the morning. As they get, maybe they're getting the kids ready for school, they're pushing all the energy out that they can, and then the kids leave and all of a sudden they feel a crash come. And then lunchtime comes, they eat something, they feel good a little bit for a little while, and then they crash again. Then we've got stage 3. Stage 3 is probably one of the worst, with the exception of stage 4, which is complete adrenal exhaustion. But stage 3 is an individual that can't even get up in the morning. They wake up by alarm if they have to, but they can't get going. They can't move. They can't motivate. And it happens throughout the whole day. And all they're looking for is the end of the day to come where they can fall asleep again. That's very bad. And I would say probably, I think you'd agree with me, most of what we see is stage 2.
Yeah.
And it's very typical. So in order to really evaluate what the cause is, we have to do specialized testing. It's not your typical blood test that traditional doctors do, but it might be a saliva test. And we're looking
where they measure like the 4 levels of the cortisol. Because if I pinched you, your cortisol level is going to go up. So if you measure, so you could just be having a bad morning, and if you just get a morning cortisol level and it's high, that doesn't mean you're adrenally fatigued, or it could be low and normal and doesn't mean anything. And the other thing too is a lot of doctors will say, okay, what is this conventional this functional medicine doctor or integrative doctor talking about adrenal fatigue? If they're worried about cortisol imbalance, then what normally people do is they do a 24-hour urine for cortisol.
Right.
Okay, that's how you do it, and you look for low levels. So if you measure low, then you're having some sort of you've got an adrenal insufficiency. Right. That's what we call it. Okay, in conventional medicine. Well, wait a minute. If we're just saying you're going through these highs and lows, you could be pumping out a lot of cortisol because you just had a cup of coffee. Now you're crashing, and ultimately over 24 hours, it's come out normal.
And that's really important. Typically when we see a spike at the end, we need to start looking at something else. And that oftentimes leads me to think maybe gut. Exactly. There might be parasite. And this is when parasites wake up, is at night.
Yeah.
So it leads us to other testing that's really crucial and critical to evaluate the function of an individual.
Yeah. And I think also with adrenal fatigue, it's very important to even explain what the concept of adrenal fatigue is, even though you explain the stages.
Right.
And just in layman's terms for you guys to understand, that would be saying, okay, let's just say I've got the stressors, everyday life stress. I've got to get up in the morning, I'm late for a meeting, oh my God, I got to go here, I got to go there. So the adrenal glands, when they're young, when you're young relatively, they say, okay, he or she wants to get the cortisol levels up really high, like they were in the morning time, in the evening time, that's fine. I can do that. I get plenty of time to rest. The person's going to rest, so I can pretty much recuperate. Okay. Well, as time goes on, the adrenal glands are saying, wait a minute, this person just wants to be on adrenal all the time, adrenaline. I can't do this. And then they're not sleeping on top of this, or their diet is really not very good, or they're taking this coffee that's causing them to go up and down on this. I can't keep up. And then the adrenal glands maybe start to poop out. They're saying, okay, forget it. You want to have a cortisol surge? I'm not giving it to you.
Right.
So where are you going to get it?
What happens over time then is cortisol wants to keep producing. And then we have what's called pregnenolone steal or cortisol escape, where the body will start producing more cortisol to support the need. And what happens then is all of our other hormones start to deplete.
Exactly. And pregnenolone goes to like progesterone, and especially in women, because their period, they're in a menstrual cycle, progesterone is very important. It'll start to steal the progesterone even through this enzyme 17-OH hydroxyprogesterone pathway. So this is called and then they'll make the cortisol, but then they get all these menstrual issues. And so now I'm wondering why all these women who are like in their 30s are getting all of these menstrual issues happening.
Well, not only women. I mean, men, you've got testosterone on that cycle as well.
Yeah, I'm just getting to them. And so the men, absolutely. So the men start doing that similarly with the testosterone. That affects their insulin levels. That's right. Because the lower the testosterone, then the insulin levels get affected.
So it's a whole cycle.
It's a whole cycle
that we need to deal with.
Yeah.
And traditional medicine doesn't approach it like that.
No. And it's just and then we give, and then the way we treat it, well, we'll get into the treatment later, but I think it's so important to recognize this. And some of the symptoms are brain fog, and it affects your immune system. And sometimes you can then weight gain, especially this weight gain around the middle can be due to just adrenal fatigue, right? But then what the worst thing to do is that person tries to go and exercise more. When you exercise more in adrenal fatigue, your cortisol goes up again, and then you're wondering, okay, well, how am I exercising and I'm gaining weight? Yes, it's such a vicious cycle.
So we get into the weight gain, we get into the fatigue, we get into the brain fog, we get into digestive issues.
So that's called tired and tired. But then you can also have the tired and wired, where the person is now tired and wired. They can't sleep. They're like losing muscle mass because they're on overload.
Right.
So within this stage 2, you have these different stages of different variations, like tired and tired and wired.
Exactly.
Which one are you, audience? Seriously.
Depends what phase of life they're in right now. If they've had kids, or they're having kids, or they're with kids right now, that's a big factor, and that's when we see a lot of women have this tremendous change in their energy as well.
Yeah. And ultimately, if that continues to get depleted, then we know that that's going to affect your neurotransmitters. And neurotransmitters, as we know, are, they're get up and go. They tell your body, like either you have your get up and go, like epinephrine, norepinephrine, and dopamine, or you have your chilled out ones, like serotonin and GABA, that help you feel relaxed.
Right.
We actually give medicines to affect these neurotransmitters.
Or nutraceuticals.
Well, in conventional medicine, we give medicines.
Right.
Like we give, Prozac, right, for serotonin.
Right.
And then we give like a Valium or Xanax for GABA. We give Ritalin for norepinephrine and epinephrine.
Right.
And we give, in Parkinson's, they get low dopamine.
Right.
So, or restless X syndrome and all is all low dopamine. So it's amazing how the only reason I want to talk this way is because I want you guys to understand that Dr. Ross and I, we think what's going on inside you, because you're an individual, you're unique, and these are imbalances. You're go to the regular doctor and say, check me out for adrenal fatigue. They're not going to be able to do any test.
They don't know what it is.
First of all, they don't. Even if they do that 24-hour urine, it's going to be normal.
Right.
So what are you going to do? Say, oh, it's a normal? So I think the take-home message is, don't give up on something when you feel like there's something wrong in your body, and you're being told that there's nothing wrong. There probably is.
There's other ways to investigate.
Yes, there's other ways to investigate, and I think the person really knows. I still believe the patient is smarter than the doctor because they know their body. Right. They may not have the knowledge of medicine, but they have the knowledge to know that something is wrong.
That's right.
Yeah, the body tells it. That's
right. They just need to find the doctor that can help work with them and investigate it.
So we have to take a break, but we're going to be right back to finish this topic of adrenal fatigue. This is very interesting. I'll be right back. This is NainaMD, Fusion of Science and Beauty. We'll be right back.